Have you ever wondered about the state of the Mexican public health system? The reality may be more alarming than you think. Mexico, once lauded for its comprehensive healthcare reforms, is now grappling with an increasingly strained public health system. In the past 2 decades, the Mexican health system has undergone significant changes, some of which have led to a decline in its quality and accessibility. Beginning with the introduction of Seguro Popular in 2004, Mexico sought to provide universal health coverage. However, despite promising beginnings, Seguro Popular faced numerous challenges. By 2018, nearly a quarter of the Mexican population was still without health coverage. Moreover, the quality of care provided by the public health system has been called into question. In 2018, the OECD reported that Mexico had the 3rd highest rate of avoidable hospital admissions among its member countries. This suggests a failure in primary care, which is key to preventing unnecessary hospitalizations. In addition, Mexico's public health system is grappling with severe financial constraints. The country spends only 5.5% of its GDP on healthcare, the lowest among OECD countries. This lack of funding has led to shortages of medical supplies, understaffed hospitals, and long waiting times for patients. The state of Mexico's public health infrastructure is also concerning. A 2019 report found that more than half of public health facilities in Mexico were in poor condition. This lack of infrastructure not only impedes access to care, but also affects the quality of care patients receive. Moreover, the distribution of healthcare resources in Mexico is highly uneven. Rural areas in particular face significant health disparities. According to a 2017 report, rural communities have fewer healthcare facilities and professionals per capita than urban areas. This gap in access to care has resulted in higher rates of preventable diseases and lower life expectancy in rural areas. To summarize, the Mexican public health system is facing a series of challenges. These include a lack of universal health coverage, issues with the quality of care, financial constraints, poor infrastructure, and significant health disparities between urban and rural areas. However, it's important to note that these challenges aren't insurmountable. With concerted efforts and strategic reforms, Mexico can rebuild its public health system. It's a daunting task, but the health and well-being of millions of Mexicans depend on it. So, the next time you ponder the state of the Mexican public health system, remember that it's a complex issue with many facets, but also remember that with the right strategies and commitment, every challenge can be overcome. And that's the story of the Mexican public health system, a tale of promise, challenges, and the relentless pursuit of better health for all.